treatments. However, endovenous laser has become increasingly popular during the last decade for the treatment of the saphenous veins. Numerous studies have proven the efficacy of the treatment for ablation of the saphenous veins, and we can conclude that the efficacy rate, even in the long term, is almost 100% if you do it right. What about the early outcome and complications? This is a study comparing endovenous laser with high ligation and stripping, and you can see after 3 months you have a success rate of almost 100%. What about complications? Complications are very minor and very rare. You can see that there may be more bruising after stripping, but the difference is small. It's important to realize that we are dealing with 3 generations of laser equipment. Whereas the first laser generators emitted energy with wavelengths that was primarily absorbed in hemoglobin, the most recent generators have wavelengths which are absorbed primarily in water. The fiber tip matters. The first fiber on the left is the bare fiber. It is actually a cutting fiber. It may cut through the vein wall and cause postoperative inflammation and pain. The 2 other are examples of fiber tips where they try to prevent the fiber tip from cutting through the vein wall. This fiber is a radial fiber and has a more smooth emission of energy, and it will not cut through the wall. And I can assure you that the fiber tip matters, but only if you combine it with the right generator. This is a sample of comparisons between different treatments. You have the laser bare fiber, radiofrequency, closer fast foam stripping, and pain score for the first 10 days was highest after treatment with laser 1470 with the bare fiber. However, if you combine the 1470 with the radial fiber, you achieve a very low pain score postoperatively. So this is what I call the 3rd generation laser ablation. Let's look at some long-term outcome. This is the first study completing 5 years observation when comparing laser ablation with stripping. You can see that there is no significant difference with regards to ablation or removal of the saphenous vein after 5 years. The same is true with regards to recurrent varicose veins. There is no difference between stripping and laser ablation. If you look at venous clinical severity score, you can see there is a dramatic improvement after 1 month in both treatments, and this improvement is continued for up to 5 years, so both treatments are efficient. Endovenous laser ablation can be very valuable if you treat a complicated case. This is a patient that was operated twice in the popliteal fossa. She has a remaining stem in the fossa, and a remaining stump in the fossa, and a remaining stem in the lower leg. This is difficult to treat with conventional surgery, and most would prefer not to do it. However, it is relatively easy to treat with endovenous methods, where you can ablate both parts of the small saphenous vein very easily in a few minutes. If you combine that treatment with a few phlebectomies, it may look like this after 4 weeks. So in conclusion, endovenous laser ablation is efficacious, it is safe, and it is well documented.